you, Dr. Battinelli, and thank you to our guests for joining us today and for being brave to come up and summarize. It's a difficult thing. You always worry that you may not catch the right words or fully express it, especially I think when we had such a brief period of time. As you can tell, we're on the clock now, so we're going to be brief, and really I'll just move forward with that to begin with you, maybe, Ann, first.
Great.
Tell me about the key takeaway components, or what came up in the discussion in your room.
Great, thank you so much. Thank you for everybody who was in the breakout session. We were changing cultural norms. We had two questions to answer. The first one is, what actions can we take as healthcare systems? The first one we talked about is, and we talked about this morning, in gun violence, words matter. So we went through a series of this or that. For example, consider guns versus firearms as the word we use. Safety, not control. Impact versus possibility. Invite, not make. Inspire, not force. We heard that this morning from Michael. We also talked about putting caseworkers in hospitals. That's something that we could do. Some of our health systems are doing that. We need a national organization to coordinate all of this work. We had some folks in the room that offered to do it, to be a convener, if you will, to make sure we're all on the same page. Very, very important. We talked about a unified message on safe storage. We are disjointed as a country, and how can we be unified in what we're saying? And then we also talked about share the effects of gun control. What happens in our EDs? What are the impacts on the body? And be more vocal about what that means. And then we talked about how health systems can work together with outside partners. Partnering with community organizations that focus on gun violence is very important, and we all need money. No surprise to healthcare leaders, that's for sure, but with the bipartisan legislation, go to the governor's office, go to who might be coordinating in the state to see if you can get grants and how can you partner. And then finally, I would add, make sure you're partnering with your academic institutions that are near you. They're great resources for research. Thank you.
Thank you so much, Ann. I appreciate that reflection. Rebecca, tell us about your room.
Yeah, thank you so much, and I'll try to summarize. We had a very active discussion and also very pressed for time. So our focus was really on how health systems use data to leverage the data for the outcomes that we would like to see here. So, and the actions that we decided that health systems should be taking here are: one is using the data of their own health systems, which we have control over, gathering that data and making sure that that data is being published and put out with the community messaging to make clear to the local community what the data is on gun violence in their community, so that then when physicians or the organization is taking action, it's understandable within the local context. That's also part of education, that health systems should be leveraging the data to improve the data systems that they're collecting and using their ability to code correctly to be able to inform multi-sector approaches by having the data systems improved and modernized. There was discussion on how we make sure that this data is leveraged in both a qualitative and quantitative way within the local context. And put into the stories that exist at the same time, so that it furthers a health equity lens as opposed to worsening stereotypes. And then our second question was on how we partner, and we had really two strong themes that came forward with how health systems should be partnering, specifically on data with others. One comes up from local HHS folks in terms of using the HHS regional offices as a connecting point for health systems to be able to coordinate across the system and their region to understand what others are doing and to be a clearinghouse there, and also working with the local health departments. And then the second, I think is really important, as we all talk about, we hear so many stories this morning on good individual partnerships with communities and with health systems, is how we don't have a fragmented approach for that, but how we have a comprehensive approach that is multi-sector at the base, and is building together beyond an individual organization and the health system. And then last but least, to the first point on how health systems leverage data, is obviously the health systems and the people in it, and even the recommendations that were made this morning on what health systems can and should do, often come without any data on the efficacy of those or the longitudinal long-term outcomes, and that health systems need to be able to leverage data by leveraging their organizational voice to make sure that the funding exists to be able to get that evidence-based data, including on hospital-based violence intervention programs, before they are moved forward actively, that we need to leverage the data and make sure that we get the data on that, because we wouldn't roll out almost any other medical treatment with as little data as is often being rolled out from our health systems right now. And it's our responsibility to make sure that we're giving our patients interventions and preventions that work, and that we collectively need to own increasing the data to support those and to support the community voices who are influencing and who want this to work in their community and are best messengers. Thank you so much.
Yeah, thank you, Rebecca. I think it speaks to us empowering ourselves as health systems and really engaging in that way. Yeah. Leif, can you bring us home?
Yeah, pick up on a couple of themes here. It's an honor to report out on a lightning round, a very deep lightning round, mind you, that we moved through around interventions and prevention strategies. So a couple of words came up, picking up on some of the themes here. Prevention, a word came up of prehabilitation, which I thought was interesting. Getting out in front around partnering in communities, certainly hospitals are a key part of that, but that should be public-private as well, right? Government should be involved, and of course, community groups. It came up to really be a good hospital and to do good health, right? To keep it simple. And our group punched that. Now, there was a key around partnering with trusted messengers in the community, and not just only pre, but also during treatment and after. And I think that was a key piece. I think hospital-based violence intervention programs are key. We talked about institutionalizing those, right? That hospitals should have HVIPs or hospital-based violence intervention programs, and it should be standard. And last was hope. We should be the loudest voice at many tables around the impact of violence, and that should inspire at some level how we can get to better prevention. And community partnerships are key in that too. So a lot around community out of our group, no surprise, but hospitals are center to this work.
Yeah, thank you, Leif. I think ending on the word of hope is the perfect way for that part of the conversation to continue. Because really, as you mentioned, it was way too much to cover in too short a period of time, especially with an engaged group. I know one of the things that we appreciate is that we're not starting at zero. So many of you have been a part of this conversation and understand exactly where we need to go. And when we don't understand it, to work together to find that data and to find the path forward. So please continue this conversation. Please continue this networking. Please continue this work together. We will help to facilitate that after this, as we've done with each of the forums that we've had over the last few years. And with that, I think I'd like to thank the panel for their time today and for the group for all the work that you did together. So thank you all. Give yourselves a round of applause.